Okay, we're going to go ahead and get started. So, just right here. All right, so this is the webinar common biofeedback applications, part one. So we're going to just be talking about some of the things that biofeedback is used for, and I'll show the list here. So we're going to start out in this part talking about tension headaches, anxiety, insomnia, ADHD, and those are the ones that we'll work on today. And then in the next section, we'll deal with depression, PTSD, hypertension, and pain. So these are some of the things that biofeedback does for healthcare. It provides a non-drug alternative for patients. It can improve outcomes because we're not just treating symptoms, we're actually working on physiology and dysregulation in the physiology that may be part of what's causing the symptoms. And we're training the body to stay well rather than just dealing with the symptoms of illness. And for a practice, it's something that can help to increase income because you're adding services to the practice in addition to the ones that you're already offering. So these are some areas of healthcare that can use biofeedback. You have mental health, that would include psychologists, psychiatrists, social workers, mental health counselors, and then you have pain management that would be more in the medical area, dealing with things like tension headaches, neck pain, back pain, etc. And then you have neurology where we can get into some of the other problems that biofeedback can work with as well, looking at things like migraine headaches, and also we're not really dealing with it in this section, but even things like seizures, uh, concussion, and so on. So tension headaches, I would say, are one of the most common things that biofeedback is used with. And there has definitely been evidence to show that surface EMG is one of the modalities that is useful for helping people with tension headaches. Um, you can think about tension headaches being associated with excess muscle tension, people not being aware that they are tensing their muscles as much as they are, and surface EMG being a tool that can be used to help people become more aware of tension and help to aid in being able to release that tension and practice releasing that tension, becoming more sensitive to when they're tensing the muscles so that they don't get in the habit of increasing the tension and holding it there for long enough to cause the tension headache to be triggered. And it also can be helpful in long-term management of headaches, because sometimes headaches will come on again because a person goes through a stressful time and they sort of forget some of what they learned, start to tense the muscles up again. But after a series of biofeedback training, it becomes much more automatic to be aware of and notice and be able to release the tension so that the symptoms don't end up coming back. And for tension headaches, biofeedback is something that has been um, used for quite a long time. As you can see, some of the research goes pretty far back, and combining the biofeedback with relaxation training and stress management can help to produce much better results. This is an example of what it looks like to have surface EMG sensors on a person's forehead, measuring muscle activity from that area. Even from that placement, even though it's on the forehead, you will pick up muscle activity coming even from the jaw and even the throat. So you can see if the sensors are placed in that area when a person swallows, or if they bite their teeth together, you'll still pick up some of that activity, and you can train them to be aware of any tension in the muscles in the face. It also will pick up from the scalp as well. If you did want to be more specific to where you're picking up the tension, let's say you wanted to pick up from the jaw, you could put the sensors right on the jaw and it would be more specific. If you wanted to pick up tension from the back of the neck, then you would put the sensors there. Here it mentions that biofeedback also has particular advantages over most medical treatments for headaches. Not only can it produce long-term remission of symptoms, but it also does so without side effects. On the contrary, common side effects of medical treatments of headache include weight gain, sedation, and impaired concentration. And headache medications frequently lose their effectiveness over time. Well, the other thing I would say about side effects is with biofeedback, sometimes you actually have positive side effects where a person learns a skill like relaxing your muscles and being more aware of it, and that can translate to other things that it might help with as well. So besides tension in the face muscles that would cause headaches, you think about even someone who was tensing their jaw and clenching their teeth, that might be causing headaches, but it also, if they learn to relax those muscles, could help with jaw pain that they might get and even damage to their teeth as well. Then there's a rating scale for efficacy of biofeedback. It's from 0 to 5, 5 being the highest level. So biofeedback is rated a level 4 in efficacy for tension headaches, and actually need to update this because the later date would have been 2016 as far as when that was put out. So that's tension headaches. Now we'll move on to looking at anxiety. That's also listed as a level 4 for effectiveness. And multiple case studies have demonstrated clinically significant outcomes with carefully screened and thoroughly assessed participants for various forms of anxiety-related disorders. There are different modalities that can be used with anxiety. One would be surface EMG, heart rate variability. Biofeedback is also widely used for anxiety. And then neurofeedback is another area that's or modality that's used for helping people with anxiety. So for example, training to increase alpha waves, which is 8 to 13 frequency, that is associated in the brain with a relaxed state. So usually when you close your eyes, you would produce more alpha waves because the brain is not busy processing the visual input, and so it tends to be in a more relaxed state. Often you have people that even when they close their eyes, they are not really that relaxed, and you can see that with using the EEG, measuring the amplitude of the alpha, and you can train a person, giving them feedback when their alpha increases to sort of turn off the excess activity in the brain that goes along with anxiety, and have more of the calm, relaxed state that goes along with increased alpha. So that's another area that can be used for working with anxiety. So you have surface EMG, you have heart rate variability, and you also have EEG as well for doing alpha training. And you can even expand it from there. You can look at, there's applications using skin conductance or measuring arousal reactions. Think of things like startle response and so on. And so training a person to decrease their skin conductance level and possibly increase hand temperature or other ways to use biofeedback with anxiety. So this is just looking at some of the work that was done with anxiety. This was a group of high school students that went through using biofeedback. And one group used biofeedback, and then you had it compared to no treatment and control groups. There was a reported significant improvement in the anxiety, somatization, and depression in the treatment group when compared to the controls. And then these are some other references for using biofeedback with anxiety. And of course, as you know, anxiety is a pretty big problem and seems to be growing. And now we're even seeing a lot of commercials on TV about therapy now for anxiety and for other types of disorders. Well, biofeedback is one of the tools that can be used to help people that have issues with anxiety. And one of the things that I think is really helpful in terms of using biofeedback as a tool, although other types of therapies are useful and helpful, biofeedback actually helps a person see how their body is responding or reacting to stress, how it's actually showing changes of increased heart rate, decreased hand temperature, increased sweat, higher muscle tension. And by learning to control these things, a client can learn that they actually have more control over the anxiety than they might have thought that they did. So it's not just what they're thinking, it's what their body is doing in response to it. If they're able to learn to control the reactions of their body, it helps to change how they actually feel. So this is looking at QEEG guided neurofeedback for anxiety. And this is where they would measure the brain activity throughout the brain, usually 19 different sites, see where there's dysregulation. Some of the dysregulation that they might find is higher levels of the fast high beta activity that's associated with anxiety, and maybe lower levels of alpha that's associated with relaxation. And they would train to decrease the high beta activity and increase the alpha activity. And that would help the brain to be in more regulated state and a more calm state. And then we go from there and we look at insomnia. So notice here the level of efficacy for insomnia is listed a little bit lower. So it's a level 3 instead of 4, like headache and anxiety were. But it's still shown as being effective. And you have, this was experiment that showed several non-pharmacological techniques, particularly relaxation and biofeedback, producing improvements in some aspects of sleep, but question whether the magnitude of improvement in sleep onset and total sleep were clinically significant. And they just looking at some of the things that you might do for insomnia. Again, you might use EEG and looking at possibly increasing alpha, but also there's another frequency range that's close to alpha, which is SMR, sensory motor rhythm. And that's a frequency that seems to be very connected to quality of sleep. So training to increase SMR activity helps to regulate sleep, as well as training to increase alpha helps with onset of sleep. This is just another experiment that was looking at non-drug treatments for insomnia. Recommendations were developed based on this review using evidence-based methods. Psychological and behavioral interventions are effective in the treatment of both chronic primary insomnia and secondary insomnia. Um, so you have, sometimes people have trouble falling asleep, and then sometimes the quality of the sleep is what is a problem, and also waking up after after they've fallen asleep. And I think the alpha and alpha theta types of training help with the letting the brain sort of get in less of a busy state so that a person can fall asleep. And as I mentioned before, the SMR types of training seem to be more effective with the person staying asleep and the improving their quality of sleep. Stimulus control therapy, relaxation training, and cognitive behavior therapy are individually effective therapies in the treatment of chronic insomnia, and sleep restriction therapy, multi-component therapy, biofeedback, and paradoxical intention are individually effective therapies in the treatment of chronic insomnia. Another thing that is helpful with sleep we'd be going back to the heart rate variability. So heart rate variability is another modality that is helpful with sleep, and that goes along with teaching a person paced breathing, slow paced breathing, but looking at how the heart rate variability increases as they do that. Positive imagery also works along with heart rate variability. And you can also look at surface EMG as a way of teaching a person to become more physically relaxed. And with the body in a more physically relaxed state, the person tends to be able to fall asleep more easily. Here's some additional references here. So this one also shows progressive relaxation, EMG biofeedback, and biofeedback placebo in the treatment of sleep onset insomnia. And one thing I would say about some of the research with biofeedback, when you try to do placebo with biofeedback research, it can be a little tricky to do, because if a person understands what the instrument is supposed to be showing, it becomes more difficult to give them false feedback, because they can do something that they would expect to see a response in the instrument, and if they don't see the proper response in the instrument, then they might likely know that it's not real feedback. So that's one of the things that makes the doing research with placebo or fake biofeedback a little more difficult. And then we move to ADHD, and ADHD is an area that would be more specifically neurofeedback. There is some biofeedback that might be used, but mostly we would be looking at neurofeedback, and the neurofeedback tends to focus on inhibiting or decreasing the amount of theta waves in the brain, especially in the front half of the brain, that would be associated with a daydreamy type state, and then increasing beta, the faster waves that would be associated with an alert or focus state. That's the sort of standard protocol, but mostly we would recommend doing a brain map so that you can see actually what is going on specifically with that person's brain throughout, and not just one area, but just to see exactly what's happening, because sometimes there could be different dysregulated pattern besides the standard high theta, low beta pattern. And in some cases, although alpha is a good brainwave to have, that shows a relaxed state, if you have too much of it, and think about it being like almost in a meditative state while you're trying to do some active thinking or work that requires a lot of focus and alertness, it may not be the best state for doing that type of thing. So sometimes it could be that a person has more theta, I'm sorry, more alpha than is helpful, rather than the problem being that they have too much theta. Another pattern that a person might have that could cause problems with attention would be they have too much high beta. So that would go along with an anxious state. And even though the person is complaining of an attention problem, their attention problem might be related to anxiety that might not be diagnosed. And the anxiety is causing them to have a problem focusing. And so that would be a different pattern that we would see in the EEG. And so the protocol that we would use would be different. So rather than trying to increase beta and decrease theta, we might be just trying to decrease the higher frequencies of beta. And that might be what would help the person with their ADHD symptom. There have been even cases where a person has been uh, prescribed medication, stimulant medication for ADHD symptoms, and it didn't help them, partly because they had this anxiety pattern. And so their problem really was more of an anxiety problem. And so in a case like that, neurofeedback can be helpful. But even if the person was going to do medication, the proper type of medication um, might have been opposite from what they had been given. And so ADHD does have a good amount of research behind it. And again, a lot of the research has used the theta beta type of protocol, but it's been shown to be effective. Um, and it's one of the most widely um, uh, the neurofeedback is used probably for ADHD more than most of the other applications it's used for. So it's used for other things like anxiety and so on, but I think ADHD seems to get most of the focus and has more research than some of the other areas. And Vincent Monastra is one of the people who's done quite a bit of research, and the research that he did was pretty well accepted and referred to in neurofeedback and in general. A lot of people are, especially parents, seem to be pretty motivated to help their children with ADHD symptoms, and especially if they have any concerns about the medications, looking for alternatives to the medications. And not only for children, but also for adults, it's something that can be very effective. I know of an adult who was diagnosed as having ADHD. He was taking medication and actually had a heart attack, and stopped taking the medication with, after consulting with the doctor, and went through neurofeedback, and it helped him quite a bit. And so it's an area that it gets a lot of attention, and people are looking for neurofeedback providers for ADHD in general. This is also an area that you see the top of this slide, Dennis Carmody and Mary Jo Sabo and Linda Vergara, the 2001 EEG biofeedback. That was actually part of what's called the Yonkers Project, and that was a project that I actually got to participate in, where we did neurofeedback for ADHD, learning disorders, and also behavior problems in the public schools in Yonkers, New York. And that program ran for about 6 years, and over 300 students went through that program and got neurofeedback training at the school. And in that case, it was a program that was no cost to the parents, because it was funded by some local politicians and also some other grant money that was provided for it. This is some additional work by Vincent Monastra and others. Joel Lubar is another person who did a lot of the research for ADHD and neurofeedback being used for ADHD. So that's just a quick review of some of the things that biofeedback and neurofeedback are being used for in practice. And in case some of you are interested in doing biofeedback and what some of the things are that it's used for, it gives you some information on that. We're going to go over the rest of the list in the next session, which I'll send an announcement out for that. And if you have any questions at this point, you can, if you like, you can unmute and you can ask any questions. Otherwise, we will end the session. And if you think of anything that you want to contact me about, as far as any questions on this or any additional information on biofeedback or neurofeedback or any of the training programs that we offer, my contact information is here. The phone number is email and the website. And I look forward to speaking with you if you have any questions.